Yes, good evening. First tonight, a woman from the East Midlands is among the first in the country to use a new law which allows patients to refuse medical treatment.
Penny Bassey from Nottinghamshire has motor neuron disease. She's put her wishes in writing in case she loses the capacity to tell doctors what procedures she doesn't wish to have. Our health correspondent Rob Sissons reports.
They're not easy decisions to make, and you do need to think long and hard about it and discuss it with family and friends and your loved ones.
How does that make you feel?
Supported by this expert from the NHS, Penny's made some of the hardest choices of her life. She has motor neuron disease. It's getting worse and will one day kill her. She's written down the medical treatments she wants to refuse, in case she loses the power to tell doctors herself.
If I need any invasive treatment, for instance, if I were to collapse with a heart attack, then at that point I wouldn't want cardiopulmonary resuscitation or to start again. I know most people would say, gosh, I need that definitely. But because I have a terminal illness anyhow, I don't want that kind of treatment in that situation.
This is a new law being implemented from the 1st of October of this year. It actually says people now have a right in law to say what they don't want in terms of treatment in advance.
For her husband, it's offered peace of mind. Agonising decisions that may, of course, hasten her death.
I've lived and loved Penny for 25 years, and it's been great. And I want her to remain in control of her life and, when the time comes, to die with dignity.
Experts say Penny's decisions have been made possible by the new Mental Capacity Act, a huge change.
One thing is clear, and that is that it's going to potentially affect almost everybody at some stage in their lives, be it with regard to their own care or indeed with regard to the care of a relative.
Penny's made her choices with the help of the NHS. If she wanted to appoint someone to make decisions for her, that would require a solicitor.
I now feel that I am in charge, as much as I possibly can be, of decisions about my treatment. At the moment I can certainly vocalise them,